Getting acute kidney injury question wrong. Use this trick and never get it wrong. Let's do this. So there are parameters you have to see on your exam day to differentiate between the pre-renal and renal azotemia. The first one is the blood urea nitrogen over creatinine ratio. It is increased in the case of the pre-renal azotemia. Why so? Because your renal tubules are intact and the ammonia is being reabsorbed. So ultimately, your blood urea nitrogen over creatinine ratio is going to be increased, that is greater than 20. While in the case of the renal azotemia, it is typically normal. Now let's talk about the urine sodium. In the case of the pre-renal azotemia, urine sodium is going to be low, usually less than 20 milliequivalent per liter. Why so? Because your renal tubule is intact, it is being reabsorbed. And in the case of the renal azotemia, it is going to be high. Same goes with the FeNA, that is fractional extraction of sodium is less than 1% in the pre-renal azotemia and greater than 2% in the case of the renal azotemia. Then we look at the urine osmolality. If it is greater than 500 milliosmol per kg, then it is the pre-renal azotemia, and if it is less than 300 or you can say equal to 300 milliosmol per kg, then it is renal azotemia. Let's talk about the urine specific gravity. In the urine specific gravity, it is greater than 1.020 in the case of the pre-renal azotemia and less than 1.020 in the case of the renal azotemia. And one more clue that is actually a buzzword in the question, that is renal microscopy of the kidney. If you see hyaline changes, then it is pre-renal azotemia. If you see words like muddy brown cast, then think about the renal azotemia. Thank you so much. Follow for more.